of the virus in the region. Kevin Ogutu, good morning. Kindly give us the latest update when it comes to the status of the COVID-19 in the region.
Well, thank you so much, Brenda. From the lakeside county of Kisumu, we are still reeling from the wave of COVID-19 that has led to unprecedented number of infections in this particular county and the neighboring regions. And as you mentioned, the county government of Kisumu had seen the need to really clear the large number of bodies that had not been interred in both public and private hospital morgues within the county of Kisumu, are hoping 212 bodies in number that had not really been taken by their loved ones for interment. At the time, this communication came from the Department of Health in the county government of Kisumu. I had the opportunity to speak with the CEO of Jaramogi Oginga Odinga Teaching and Referral Hospital. This is one institution whose morgue had a record 104 bodies. But from the discussion that I had with Dr. Rai this particular morning, there's been that steady uptake of the various bodies that have not been claimed by their relatives. I mean, the bodies that have not been interred. We have bodies that are staying there for various reasons, but we also have those bodies that are unclaimed, meaning they've been there for years, if not months. Of course, it is clear that there is a procedure when it comes to disposing of unclaimed bodies, and that is why the county government of Kisumu had given 48 hours ultimatum, after which they will need to seek the opinion of the courts to get a court order so that they can do the mass burial of the bodies after getting that particular court order. This, according to the multi-agency COVID-19 response team, is supposed to really ensure that the burial protocols are followed. Remember, if we continue keeping bodies for more than 48 hours, as it has been stipulated, then it becomes very difficult it becomes very easy rather for a relatively larger number of people to travel to the various funerals for the purposes of burial. Remember, the burial is supposed to be the affair of the family. But before we get into the details of these are the statistics of COVID-19 as we speak right now. The county has seen 5,994 COVID cases from 43,000 tests that it has done from March 9 last year when the COVID-19 virus hit the Republic of Kenya. And the weekly positivity rate is at 28.4%. So the county had registered 139 deaths at the time of this particular communication, and that is why there's been need for the various agencies really to come together to streamline these protocols. So as we speak right now, we must be fair to the county government of Kisumu and all the various stakeholders that they're trying their best in terms of public transport, in terms of ensuring that the bars close at 7 p.m. and everyone disperses. Yesterday there was a spot check during the day, just various pubs and restaurants, just to ensure that there is that social distancing in practice, not just in theory. So that is the much that we have from this end. It's still a teething problem, but we thank God that there have been that uptake of the bodies that have been lying in various hospitals, morgues, both private and public, within the county of Kisumu. So that's the much that we have from this end. Back to you in studio, Brenda.
All right, Kevin Ogutu, thank you for that update on the COVID-19 headache, the headache that the county government is facing right now, how to contain the spread of the virus. But then, Muslims will not attend this year's Hajj pilgrimage for the second year in a row. Actually, the Kingdom of Saudi Arabia has issued strict limitations on attendees of the annual event. And let us to speak to the SUPKEM National Chairman, that is Hassan